Precautions and compatibility of biomagnetism. Biomagnetic pair is a clean, natural, and painless therapeutic technique that is perfectly compatible with any other alternative therapy or conventional medical treatment. Even if it is very safe, there are a few cases in which the therapist must be careful. The first warning is not to depolarize the biomagnetic pair uterus-ovary in a patient who is pregnant. Doing it could cause an abortion, especially during the first weeks of gestation. The therapist should ask the patient if she thinks she might be pregnant. If there is even a slight suspicion, the therapist should follow the warning mentioned above. And as an extra precaution, the therapist should also refrain from placing two magnets of opposite polarity in the abdominal or pelvic area of such a patient. Placing a single polarity for scanning purposes does not involve any risk at all. But putting the two polarities to rebalance the pair could be risky. The second warning is not to put any magnet, even a single polarity, near a patient's pacemaker. A patient with a pacemaker can be scanned in almost all areas, but not in those that require to bring the magnet within 8 to 10 inches of the pacemaker. Doing so could drain the battery of the pacemaker abruptly. The same applies to batteries of other devices, such as implants for pain management, cochlear implants, insulin pumps, hearing aids, etc. With respect to artery stents, there is no problem putting magnets in the area. But if the patient has a brain valve having ferromagnetic material, the therapist should refrain from placing magnets near the valve. The third warning is not to treat any patient who received a dose of chemotherapy in the last 12 months or who will receive it shortly. The therapist could check the various scanning points with a single magnet, but he should not balance altered biomagnetic pairs in such a patient. The reason is that chemotherapy is extremely toxic and aggressive. Pathogens that the patient has, particularly bacteria, produce markers that prevent the toxicity of chemotherapy from fully penetrating the patient's cells. But depolarizing the altered pairs will eradicate these pathogens. The mucus surrounding all those cells will be removed. Since then, the poisonous chemotherapy will have free rein to enter fully into the cell, and then the patient can die from poisoning. After a session of biomagnetic pair, the patient's depolarized cells will be more permeable and receptive. Chemotherapy or radiation therapy will be even more aggressive. But if we apply other remedies, like homeopathy for example, these remedies will be enhanced and more effective. Another reason not to mix biomagnetism with chemotherapy is that a patient who has undergone chemotherapy has a greatly weakened immune system, and it is the immune system that can heal. But if it is too weak because of the disease and because of the toxic chemotherapy, then survival chances will not be very high. In this case, the therapist should not take the risk of caring for that patient unless he is a relative or a close friend. These are the three main warnings that the therapist should follow scrupulously. Finally, keep in mind that biomagnetic pair, like any other natural therapy, is not an emergency medicine. Therefore, before any emergency, the patient should always go to a hospital or to a licensed physician.